Now, to learn more on that, we have with us tonight the WHO representative to Oman, Dr. Akjemal Maktimova. Dr. Akjemal, good evening to you and welcome to the studio here. Dr. Akjemal, can you please highlight to us about the importance it has, this particular meeting here in the Sultanate of Oman?
Indeed, last week entire world was focused on Oman as WHO convened this global meeting, bringing together representatives from over 100 member states, from over 40 non-state actors, and I'm talking about alliances and associations from food and beverage, pharma, medical associations, 20 young leaders across the 6 regions of WHO to actually address the major killer of the 21st century, to leverage on our efforts. We have our loved ones who suffer from diabetes, hypertension, stroke, cancer, and these diseases are taking 41 million people, and 15 million are dying before they reach age 70. And WHO has technical packages, guidelines, and if those guidelines and packages are implemented, we can save until 2030 350 billion in economic growth. Oman has not been chosen by coincidence because Oman, together among 194 actually member states, Oman has been chosen as a venue not only because of its hospitality and beautiful backdrop, but because of efforts and great and measurable achievements it made. To name a few, we are talking about taxation of tobacco, sugar, sweetened beverages. We talk about reduced salt, which are known risk factors for non-communicable diseases. I would like also to mention, in fact, that those representative participants of the meeting were hosted and visiting medical facilities, health facilities of Oman on day 4 to see how it works on the ground and how it works in practice.
Right, talking about 40 million annually, that is really too much. And all the causes, as you said, the risk factors of using salt, sugars, and not being active, this is what you've talked. But when we talk about the NCDs, does that mean non-communicable disease? You're talking about cardiac condition, cardiovascular diseases, you talk about diabetes, you talk about mental health and many others. And not only the someone not to be what you call active, but can you tell us more about it?
Right. I would say with confidence that risk factors, accumulated risk factors, are causing non-communicable diseases in addition to biological factors. And those risk factors we need to be aware of. And as one of the participants, actually Under Secretary for Planning Affairs of the Ministry of Health put it, education, awareness and education are the most important factor. I would like to name those risk factors. These are lack of physical activity, use of tobacco, high intake of salt, sugar, and fat. We should be aware of it, and if we should be aware of the way how we live in this fast-paced, fast-speed, and fast food world. We have to make our healthy choices. And if I have to choose one area to plea to the audience, I would like to speak about our children and our adolescents. We had World Obesity Federation conference recently hosted in Oman. And I would like to note that our children, obesity and overweight in our children in the Eastern Mediterranean region is above global average of 7%. Our adolescents in the 22 countries, and Oman is not an exception, are least active in the world. And basically our region is topping up adolescent in activity. What it means that we have to protect and prevent non-communicable diseases in our children so they can lead healthier lives, productive lives, and live in wealthier countries where we don't need to spend money for treatment.
Indeed, so people need really to be active on that. Now, what we know that also Oman, in particular Muscat and some other cities, become a health city. What can you tell us about that?
I am very proud and actually very thankful for the governor of Muscat for agreeing to be part of Healthy Cities Partnership. It is a partnership. Earlier this year in January, we have celebrated Sur being acknowledged as healthy city within the regional network. And this network is a global network, prestigious network for cities which committed for healthy environments. And when I met last week with the governor of Muscat and we looked through 14 interventions, actually I have to acknowledge that almost all of those interventions have already been in place in the case of Oman, in the case of Muscat. But maybe what we could feel we could do more was about actually physical activity, to create more environments, better environments where we can bike, cycle, run, move, and actually increase and encourage everyone to be able to move and lead healthier lives. I would like to use this opportunity to actually thank the government of Oman, to send profound thanks on behalf of the WHO to the government of Oman, to all the partners and who have supported and organizers who have supported this mission. And I would like to assure you that at least 500 more people across the globe fall in love with Muscat, beautiful city of Muscat, beautiful Oman, hospitality of Omani people, and they are going to carry this love and the knowledge and the enthusiasm and energy which they have gathered in this meeting back to corners, different corners of the globe, to actually sustain efforts to beat NCDs, non-communicable diseases, and save lives of many more people.
Wonderful. Thank you very much, Dr. Akjamal, for this information, which are very important. That means that each and everyone, and as you stated that here in this part of the world, people are not that active. We need to be active. Each and everyone needs to be active. From me, you, and all youth there, please get up and make a movement. So thank you very much for your time, and we do appreciate being with us here.
Thank you so much.
Thank you.